We have Renee join us from Pennsylvania via Polycom. Also joining us is Dr. Rick Kaiser from the Wills Eye Institute in Philadelphia. Welcome to you both.
Thank you. Thank you. Thank you. Thanks for having me.
And we're always talking, Dr. Kaiser, about the diabetic complications folks have to worry about. Vision is a major one. How does diabetes take you down the vision problem pathway?
I think it's really important for people to understand just a little bit about how the eye works. So we have a model here. Light comes in through the front, goes through the lens, and it goes through a cavity in the center where there's a gel, that's the vitreous. And then there's the retina, which lines the whole back wall of the eye. It's like wallpaper in a room. In the center of the retina is an area called the macula. That's your bullseye central vision. That's what it gives you all your fine focus. And unfortunately, that's where diabetes centers its damage. That's where it focuses on.
So much like when we talk about people with macular degeneration, they lose that central vision. Same thing's happening for these folks with diabetic
Absolutely.
retinopathy.
It targets that central vision. And that's what we brought some pictures here. So if now we're looking straight into the eye, we're looking at the back of the eye, we're looking at the retina, and specifically we're looking at the macula. And so this yellow disc is the optic nerve, which connects the eye to the brain. And this central area, this is a normal macula. You want that orange pigment there. This is normal. And I think it's important to see normal so you can understand disease. Here's a case of someone who's actually had diabetes for about 10 years. There are hemorrhages here. There are different stages of this. This can progress to the point where this stage causes a loss of central vision.
And do we have an advanced one? Or
We do.
Because
we
this
do.
is where you really run into massive problems. You know, we've switched the side here of the eye, just so people aren't confused.
Right.
The optic nerve.
Yeah, we're looking at a right eye versus a left eye, but it's the same principle. Here's the optic nerve that connects the eye to the brain, and this is the proliferative stage of diabetic retinopathy. This is the most aggressive stage. Basically, what happens is new blood vessels grow sort of like weeds in a garden, and they pop up in different areas, but those vessels are very fragile. They can break open and bleed, and you can see areas of blood that are starting to cover the retina here. And those blood vessels can cause scar tissue, and they can actually detach the retina.
And so she had actually bled into this area in the back, and this is where you were, in this area.
She actually bled through the entire central cavity of the eye. So the entire central gel was filled with blood.
And you were in here taking out that blood
out of
with
the vitreous
with
gel.
your instruments in the surgery.
And after we removed the gel, then I had to work on the scar tissue, which was on the surface of the retina, so that the retina wouldn't detach, it wouldn't lift up.
And so this was a week and a half ago. Renee, how are you doing?
I'm doing wonderful. I'm still in the process of healing, but Dr. Kaiser has informed me that my eyes look great and that I'm looking forward to a full recovery.
That's great. Good job.
So obviously, Renee, people take their vision for granted until they lose it. So you expect this will probably change your life somewhat?
Definitely. This has been a big wake-up call. I could have lived in darkness, and that caused a lot of anxiety and fear. I'm really lucky. I was given a second chance, and I plan to take my diabetes more seriously and take better control.
And in the end, diabetes, type 2 diabetes, is an illness largely under your control. Quite simply, move more, eat better, and eat less. One way you can do this, just real quickly, plate your snacks out, because if you're eating all these out of the box or the bag, you're going to eat more. And then when you're doing whole grains, go ahead and choose foods that aren't going to just skyrocket your blood sugar levels each and every meal. It makes a huge difference. So go for nuts instead of just, say, plain white bread. Huge difference in your long-term outcome. And Renee, we wish you the absolute best of success and luck. And Dr. Kaiser, great work. Thank you so much for doing this.
Thank you.